Hey guys, good morning. Welcome back to my YouTube video channel again. I have just a few minutes. Just want to show you a case where we're gonna take out this tooth, and sometimes you look at the X-ray, you think it's easy, but it could be difficult. So anticipation and difficulty, and work through it. So I'm gonna show you the X-ray. I'm gonna flip this. See that I'm about to take out tooth number 29 this morning. As you can see, the date is just today. Now the patient is in his 30 years old. His tooth have been rotten for a number of years, and he still haven't taken it out. Clinically, he showed that there's fistula on the buccal side. And the tooth have zero mobility, although there is some radiolucency on there. But there is challenge that we can. Most of the time, we look at this tube and we say, it's easy, we can take it out. But if you look carefully, there is potential that as soon as you put any instrument here, you're gonna fracture right here. Once you fracture right here, depend on how easy this tooth root can be removed, it can be a problem for you. So when I elevate this one, I anticipate I'm going to hear a crack here. I'm going to have to take this part out. And if there is zero mobility down here, I have to do a surgical section with the 557 bird in order to take this out. So let's jump right. Before I go deeper, I just want to show you that my new toys here. This is the design for vision loop, that you don't look down to the patient, but you actually look straight, your back and your neck straight. It's very important. It's helpful a lot. So now let's jump right in. I numb the patient, and I told you I'm going to use the elevator to try to take it out. But as I do this, there is anticipation that this part, top part, will be fractured off, and that leave me the root part that I have to handle. So as you can see, I elevate and back and forth using leverage of the alveolar bone slightly adjacent tooth as well. But you can see now the fracture is happening because it's so rotten. There is not a lot of tooth structure to hold this force that against the what you're doing. So first we remove that portion, and the next step is to try to see if there is any mobility. Sometimes you can, and if there is mobility, then the root will be easy to remove with just a straight elevator. And I've been doing it for 20 years. It should be easy, but I do see some radiolucency. But I try now, it's kind of rotten, and it come out piece by piece. So the next step is just flap out the buccal side and use the surgical 557 bird and just section in right at the mesodistal, and then you have to take it out that way. So as I do that, clearly you can see now I have to use the flap after I flap it out, and I can see where I'm going, what I'm doing. So I section mesodistal, as you can see the bird goes that way. And after this, just use straight elevator, elevate two pieces out, and that's it. Should be done quick and easy. But as long as you anticipate, you don't get stressed out yourself, because if you don't tell the patient it's going to fracture, your patient can be mad. All right, thank you for watching. Have a good day. Bye bye.